Hi everyone, I'm Dr. Jess. I run InSync Medical. I've got Steffi with me. She is one of my patients. So today I'd like to talk to you about a condition that has pained me, and it has pained many women in a very different way. It's endometriosis. For those who don't know what endometriosis is, it's a condition that involves the lining of the inside of the uterus. Instead of staying within the uterus, it actually is on the outside of your uterus. And you can imagine if that lining goes outside and it starts forming scarring and it starts forming stringy fibrous material and it bands your whole uterus together, it can be immensely painful on a monthly basis when a woman experiences her period. So Steffi, thank you so much for coming here and doing this for us. It's a very big thing for me that you have agreed. Can you maybe tell me more about these bad period pains that you were experiencing?
Sure. Well, it's my honor to share this experience with everyone, or most of the girls out there, they might be really shy to share this or maybe look for the right doctors. I started to feel really pain since last year, and the pain went beyond my pain tolerance. So I had bad cramps. It comes anytime, basically. So it could be during in the morning or at work or even when you are sleeping. So it just comes anytime that it wants. The worst cramps that I experienced a few times, I was on the train, so I literally had to run out of the train, then look for a toilet just to lock myself, because for me, I felt that it is quite awkward to let people to see how bad the cramp is and maybe my facial expressions, right? So I just locked myself in the toilet, and that's when all the cold sweat, and just wait for the cramps to go off. Sometimes after the cramp is disappeared, I still feel insecure about it, and what I did was I went to the pharmacy to buy some painkiller, any painkillers that works, to be honest.
And would those painkillers work?
Short term, yes. I just wanted to go home, right? So just get anything that I could from the pharmacy.
Steffi, tell me one other thing. You mentioned that the MRT incident happened while you were on a period.
No. So, like I said, it could happen anytime. I actually have it, I would say 21 days. So I have it pre, during and post period. So only 1 week that I could, for example, go for a workout or runs, just that 7 days.
So would I be right to say that you are spending 1 week out of a whole month feeling good, feeling healthy, feeling pain-free?
Yes.
And you are effectively living 3/4 of the year in pain?
True. Yes.
Besides going to the pharmacies, at what point did you decide you needed to see a doctor about this?
Well, I was desperately looking for doctors. I went from doctor to doctor just to get painkillers, and I actually went to see a lot of gynaes too. What they did to me was just the normal basic vagina scan, right? And because I think my case is quite different, as in they couldn't find anything inside when they did the vagina scan. So what I felt was they just brushed me off with some painkiller, and that made me feel uncomfortable because I've been feeling very desperate and about all this pain, right? And what I need is not painkiller. I need to know what happened to me.
Exactly. And this is the thing I want to highlight about endometriosis. The pain comes back. time and time
Yeah.
and time again, and it can be also outside your period cycle. And as Steffi has mentioned, she went from one doctor to another doctor, and in her words, she said she felt like she was being brushed off, and
Okay.
you felt like you weren't taken seriously.
Yes.
How did that make you feel about your condition and going to find someone else to look after it?
Well, when you're in pain, right, then you look for the doctor and expect the doctor to do some checkup for you, right? Yes, some of them they did just vagina scan, but because my case is special, which I only found out I have endometriosis, even pre-diagnosed by you, but after I did a scan, MRI scan, and I found out that I have severe endometriosis. I would say it's better if a doctor, when a patient runs to you and seek for help, if you could just investigate or help her throughout the journey instead of giving painkillers. It's not going to help at all.